appreciate the opportunity to give you a brief update on some of the activity around St. David's Healthcare as it relates to our preparedness for the coronavirus and COVID-19. So beginning in January, our community saw an uptick in influenza-like illness and visits to our emergency departments and our hospitals across the entire community. Our emergency rooms were very full, our hospitals were very full, and this triggered a series of emergency operations meetings that included all of the major hospital systems, EMS, the State Department of Health, and multiple other agencies from the Tri-County area. We've continued those meetings on a weekly basis as we watch the COVID incident unfold across the world, and have had a lot of internal readiness activity to ensure that the St. David's hospitals were ready for an increased number of patients that we might see related to COVID. So some of the things that we've worked on have been making sure that we have adequate supplies of personal protective equipment, or PPE, and that's things such as masks, gloves, gowns, and face shields. And all of our hospitals have done multiple drills and tabletop exercises to ensure that they would be as ready as possible for a surge of patients related to the coronavirus. So one of the things that I wanted to share with you and the general public today is that effective today, St. David's Healthcare is taking one additional step to ensure that we protect not only our patients but also our visitors as well as our staff. So any patient who comes to St. David's emergency room or freestanding emergency department beginning this afternoon will be met by someone at the door who will screen that patient for respiratory illness. They'll ask a few simple questions like if you had a fever, cough, sore throat, or flu symptoms. And if the patient answers yes, then they'll put in a mask. It'll be a simple surgical mask, what we call a level 1 mask. It'll look like this. And in addition, any family member or visitor who's accompanying that patient will also be asked to wear a mask. And again, this is done to protect other patients in the waiting rooms and our staff as the patient is triaged and assessed in the emergency room. If the patient also has a history of travel to one of the countries that the CDC has defined as a level 3 country, such as China or northern Italy, then the patient will be expedited through another protocol to be assessed more quickly and placed in a special room that has negative air pressure. This is done not out of any sudden burst of activity in terms of the number of patients we're seeing, but in anticipation of, the continued growth of COVID activity around the United States, and in anticipation of several 100,000 visitors coming to the Austin area over the next couple of weeks associated with South by Southwest. We don't have a definite end date of when this screening process might stop, but we do want to just reassure our patients who come to our hospitals and the public that we have their safety and our staff's safety in mind so that our staff stays healthy and available to take care of patients. So with that, I would be happy to answer any of your questions.
Are you guys getting extra respiratory machines? I know that that's going to be a big part of treatment.
So the question is, would we have extra respiratory machines like ventilators? So that is part of our pandemic plan to ensure that we have adequate amount of respirators, and something that we've been considering in our preparation activity.
And I know we have the highest rate of uninsured people in the DC, and I'm wondering what your message is to people who are afraid of getting a big. There's been stories of surprise medical bills for people who have coronavirus. What's your message to people who are just weighing whether to go to the hospital or wait it out and get insurance?
Right. So my message to people, whether they have insurance or not, is if your symptoms are mild, just like with the flu, you may not even need to go to the physician's office. If your symptoms were moderate or severe, then you definitely should seek care either in a physician's office, an urgent care center, or an emergency department in a hospital. The coronavirus and COVID-19 is typically, for most patients, a very mild disease, could be confused with the common cold or influenza, but then for a small subset of the population can go into a very significant and serious type of pneumonia with respiratory distress, requiring someone to be on a respirator. So we really want the public to think about getting the care at the right level of care so that we don't overburden our emergency departments. And the other piece of advice I would like to be sure that the public is aware of is if you are suspicious that you might have contacted coronavirus, you've been to one of the high-risk countries, or you've been exposed to someone who is under investigation or diagnosed with coronavirus, before you go to a healthcare facility, your physician's office, an urgent care center, or an emergency department, call ahead if you can and let them know you're coming so that we can, provide the maximal amount of precautions to ensure your safety as well as our staff's safety.
Explain to folks why you're doing this. This isn't a contingency containment alert type situation. And this is more preventative.
So this is definitely a preventative measure that we're instituting today.
Could you say that again one more time? You're good.
So our initiative today to add an additional point of screening at the emergency department entrances is a preventative measure. It's nothing that should cause any panic. And we do have flu stations that are already positioned at those doors with masks and hand sanitizer and signs encouraging patients to voluntarily put on a mask if they think they have the flu or respiratory illness. And so it's just taking that one step further to ensure that that happens. Because if we have the proper protective equipment, if we have the mask and for the healthcare workers some kind of eye protection and gloves, then the incidence of transmitting coronavirus to a healthcare worker is very low. And it's not zero, but it's very low. And so, patients come to our emergency departments for many other reasons besides flu or flu-like illnesses. And so we want to be sure that patients who are there with non-infectious disease-related illnesses or complaints are also not exposed.
Speaking of panic, you see the rest of the country and all over the world where panic is, fears. What kind of message do you send to those folks where to be precautious, proactive, but not to panic? How do you measure that message?
So, based on all the guidance that we have from the CDC and public health officials and my own intuition as a physician and having done these types of things for, over a decade, there's no reason to panic. And our risk, any of our risks today here in this room are relatively low to contact the coronavirus. And so, if you just follow simple precautions at home, good hand washing, good hand hygiene with warm soap and water, using hand sanitizers, high-touch surfaces in your home, you may want to consider decontaminating with some kind of wipe, disinfectant wipe. If you cough or sneeze, cover your mouth and your nose. And so if we just follow, basic prevention precautions, then, that's the best way still to prevent the transmission of this virus or any similar influenza-like virus.
That starts today, right now, the meeting, the precautions that you're taking?
Our new screening process for the emergency department screening does start this afternoon.
Anybody else? I have one last. I imagine this is just for now, as things progress, are you guys planning on meeting about this every couple of weeks to change protocol?
So the whole situation with COVID-19 is very dynamic, and I would say protocols will be changing on a daily or weekly basis as we continue to learn more about the the virus and the extent of the virus in the United States.
Speaking of social media and all those things like that at South by Southwest, do you see people's reason for concern? And is it helpful to come out like today and show people that we are taking steps? Especially if we're going to have 100,000 visitors in town, you know how people can be.
So there certainly has been a lot of conversation about South by Southwest and the impact that it might have on our community, and hopefully by us, St. David's Healthcare, taking this step today, it will just reassure the public a little bit more that there's no reason to panic, that we have their best interest at heart, and are looking out for their safety and the safety of the staff in the hospital in the event they need to come here. Okay, thank you all.
Again, everyone, that was the Chief Medical Officer, Dr. Ken Mitchell, with St. David's Healthcare here in Austin, as that press conference comes to an end. What he was announcing, one more time for you all who may have missed what he was saying, is that starting this afternoon, when patients or families come into any emergency room or standalone emergency facility related to St. David's, there will be someone there to greet them and ask some certain questions. So if they're showing any symptoms of a respiratory illness, such as a sore throat or fever or coughing, something like that effect, if they do, they are then given a surgical mask, and that not includes the patient, but also anyone that might come with him or her, and then they can wear that inside the facility. This, again, is just a preparatory step in case of a possible spread of COVID-19, the novel coronavirus that originated in China, in Wuhan, China, and is now spread across the world and in the country here in the U.S. If you want to take a look really quickly, this is the mask that they'll be given. Our photographer was getting a shot of that here just a second ago, and it's kind of moved at this point. It might be able to come back up here shortly. We'll just take that full screen for a second. But if you saw, it was that small kind of traditional surgical yellow mask that will be given to patients and visitors at St. David's if they go starting today and experience symptoms that are that of a respiratory illness. Again, this is because of the risk and the concerns about the spread of COVID-19. He also said the hospital is doing other things, providing additional gloves, masks, gowns, and face shields to employees. They've also done drills and tabletop exercises to prepare for an influx of patients who might show those symptoms. Once again, we do not have any confirmed cases of coronavirus here in Austin or in Travis County. There have been some people that have had testing done. Those results are being, the results have not come back just yet, so just to reiterate that. And then there's also a presumptive positive case in Fort Bend County, just southwest of Houston in that area. We have more reporting on this on our website, kxan.com, and the KXAN News app will have a press conference in about 2 hours' time from the governor and the director of the Department of State Health Services. They're going to be talking about the state's ability to test for the coronavirus now and hopefully expand those services and cut down the time that it takes right now to be able to get test results for patients who might have COVID-19. We'll have that again at 2, so we'll see you back here then. For now, we're going to end this live stream, and we will join you back here very, very soon. Have a great one, everybody.